Today, I'm going to show you 12 cheap medicines that survivors stockpile before anyone else. And what matters is that most people only think about them when it is already too late. When a crisis happens, people usually rush to buy water, canned food, batteries, flashlights, toilet paper. But there is one area in the house that is easiest to forget: the medicine cabinet. And for older adults, this is not a small issue. A fever, a case of diarrhea, a small cut, joint pain, or a few days without essential medication can drain the body faster than you think. The danger does not always come from major disasters. It usually begins with very small things: dry mouth, dizziness, tooth pain, cracked skin, a small scrape turning red, or a daily pill no longer being in the bottle. This is not a list for panic. This is a list to help you look at your medicine cabinet before you actually need it. And pay attention to number 1, because it is something many people forget until their entire survival plan collapses from the inside. 12.0 RS/Electrolyte rehydration packets. A box of oars in the United States is usually not very expensive. Only a few dollars to a little over $10, depending on the brand and the number of packets inside. But with products directly related to health, it is best to buy from trusted pharmacies where the packaging is sealed, the expiration date is clear, and the instructions are complete. This is not something you should buy just because it looks cheap, because when you need it, you need something reliable, not a powder packet that leaves you guessing. Oars looks very ordinary. It does not look like a powerful survival item. There is nothing special about it on the medicine shelf. But in reality, it addresses one of the most dangerous problems for older adults: dehydration. When an older person has a fever, diarrhea, or vomiting, the body does not just lose water. It loses salt, minerals, electrolytes, and strength. That is why plain water sometimes cannot bring them back fast enough. In those moments, one properly mixed oars packet can become the thing that helps the body hold on to balance, reduce exhaustion, and prevent dehydration from quietly pulling that person down too quickly. The frightening part is that dehydration does not always appear as a major shock. It usually starts very quietly. At first, it is just more thirst than usual. Then dry mouth, dry lips, fatigue, dizziness when standing up, weak legs, talking less, lying down more often. For younger people, the body can recover faster on its own. But for someone in their 60s or 70s, especially with chronic conditions, just a few hours of diarrhea or fever can drain the body very noticeably. When using oars, the most important thing is to mix it exactly according to the instructions on the packet. If the packet says a certain amount of water, use exactly that amount. Do not make it stronger thinking it will work better, and do not dilute it to save more. Once the ratio is wrong, it no longer works the way it is supposed to. For someone with fever, diarrhea, or vomiting, it is better to take small sips, steadily, many times throughout the day. If the stomach is weak, do not force one large glass at once. Often, a few small sips repeated consistently are easier for the body to keep down. Oars should be stored in a dry, cool, clean place, away from sunlight and moisture. Do not leave it in a hot car, garage, near the stove, or in the bathroom. A small plastic container in the medicine cabinet is enough. Any packet that is torn, damp, clumped, discolored, or no longer has a clear expiration date should be discarded. In an emergency, you need something reliable, not something that makes you hesitate. Oars is very useful, but it is not magic. If an older adult has bloody diarrhea, high fever, confusion, stops urinating, vomits continuously, or becomes weak very quickly, that is the moment to seek medical help. But in the early stages, when the body is just beginning to lose fluids, Oars is one of the smallest but most valuable items to have in a medicine cabinet. It takes up little space, is not expensive, does not require electricity, and at the right moment can help an older person hold on to the most important thing: the ability to stay upright, alert, and avoid the body being drained from the inside out. If an older person in your home had a fever or diarrhea during a power outage, do you already have something ready to replace fluids and electrolytes? 11. Pain relievers and fever reducers do not wait until someone has a high fever before treating it like an emergency. For older adults, just one night of mild fever, body aches, and poor sleep can noticeably weaken the body. In survival situations, pain and fever do not just make people uncomfortable. They take away the ability to stand up, get water, cook, take medication on time, and care for themselves. Common pain relievers and fever reducers in the United States are usually not very expensive. Generic acetaminophen or paracetamol often costs around $3 to $10 for a small to medium bottle. Generic ibuprofen is usually in a similar price range, depending on the number of tablets and the brand. The purpose of this group is very clear: reduce fever, relieve headaches, muscle aches, mild back pain, temporary tooth pain, flu-related aches, or pain after overexertion. But the real value is not only in easing symptoms, it helps older adults keep their ability to function. Because during a hot night without electricity, just fever, body pain, and lack of sleep can leave the body noticeably weaker by the next morning. When pain keeps them from sleeping, when fever causes faster dehydration, when the body becomes too exhausted to eat or drink, every small task in the house becomes harder. A backache can prevent them from carrying water. A headache can reduce concentration. A prolonged fever can make them skip meals and even miss essential medication. When using acetaminophen, ibuprofen, or any pain reliever and fever reducer, always follow the directions on the label. Do not take extra just because the pain feels stronger. Especially with acetaminophen, pay close attention because many cold medicines, cough medicines, and combination products already contain it. Taking multiple products together can cause someone to accidentally overdose without realizing it. Medicine should be kept in the original bottle or blister pack, stored in a dry, cool place away from humid bathrooms, hot cars, and direct sunlight. Do not mix different pills into one unlabeled container. When the time comes, you need to know exactly what the medicine is, what strength it contains, and whether it is expired. For older adults, not all pain relievers are the same. People with liver disease need to be careful with acetaminophen. People with kidney disease, stomach problems, high blood pressure, heart conditions, or those taking blood thinners should not casually use ibuprofen or naproxen like mint candy. It is best to ask a pharmacist before buying medication to store in a medicine cabinet, because during a crisis, the right pill at the right moment does not just ease pain. It can help someone stay alert, stay strong, and remain capable of standing up on their own. Does your medicine cabinet already have a separate fever reducer, or is everything still mixed together with cold medicine? 10. Daily prescription medications. The number one item on this list is not found on the survival shelf. It does not come in attention-grabbing packaging. But for older adults, this may be the most important thing in the entire house: the medications they take every day. Not because they are special, but because without them, everything else begins to lose meaning. You can have rice, water, flashlights, canned food, radios, and backup batteries. But if someone with high blood pressure runs out of medication for a few days, if a diabetic no longer has medicine or insulin, if a heart patient has an interruption in medication, if someone taking blood thinners, thyroid medication, breathing medication, or eye drops runs out at the exact moment the pharmacy is closed, then the problem is no longer the emergency storage cabinet. The problem is inside the body itself. Older adults do not just need food to survive. They need stability, stable blood pressure, stable blood sugar, stable heart rhythm, stable breathing. And very often, that stability is being held together by small pills they take every day, so routinely that the whole family forgets how important they really are. The cost of prescription medications in the United States varies widely. Some generic medicines cost only a few dollars a month, while others can be extremely expensive without insurance. So the important point is not a specific number. The important point is this: do not let medication be interrupted. Do not reduce doses on your own just to make medicine last longer. Do not temporarily use someone else's prescription. Do not replace prescription medication with herbs, supplements, or internet remedies. Medications should be kept in their original packaging with clear labels. Medication name, dosage, time to take it, prescription date, pharmacy, and prescribing doctor. Older adults should keep a separate medication list in a wallet, phone, or emergency kit. This is why prescription medication is number one. It does not just treat symptoms, it protects the foundation. And when the foundation remains stable, everything else in a survival plan still has a chance to work. 9. Povidone iodine/betadine in survival situations. Betadine is not something meant for handling massive disasters. It is something that prevents a small wound from becoming a major disaster. And this is where many people misjudge the situation. They think a small cut is not a big concern. But the issue is not the size of the wound. The issue is the environment around it. In clean conditions, a scrape may be a very minor issue. Rinse it, disinfect it, cover it, and forget about it a few days later. But when the power is out, clean water is limited, hands are dirty, sweat builds up, dust is everywhere, and bandages are not changed properly. That same scrape becomes an open door for bacteria. For older adults, the skin is thinner, circulation may be weaker, and wounds often heal more slowly. That is why a cheap bottle of antiseptic can sometimes be far more practical than expensive survival gear people like to show off. Povidone iodine, commonly known as Betadine, is the familiar brown bottle found in pharmacies. In the United States, a small 2-medium bottle usually costs around $4 to $12, depending on the size and brand. The main purpose of Betadine is external skin disinfection, commonly used for small cuts, scrapes, abrasions, or minor burns before bandaging. But its real value is not simply cleaning a wound. The real value is stopping problems early. In survival situations, you are not just treating a scrape, you are buying time for the body to heal itself before bacteria have the chance to turn a small issue into a larger one. When using it, clean the area first if possible, then apply or dab the betadine according to the instructions on the bottle. There is no need to pour on excessive amounts just to feel safer. Disinfecting does not mean soaking a wound in brown liquid. It means using the right amount, in the right place, at the right time. For deep wounds, large wounds, heavy bleeding, serious burns, eye injuries, mouth injuries, or sensitive areas, do not rely on random home remedies. Those situations require medical care. The bottle should be tightly sealed, stored in a cool place away from sunlight, and ideally kept separately in a first aid kit because it stains easily. If the bottle leaks, the cap becomes contaminated, the liquid changes color unusually, or it has expired, it should be replaced. And one thing should be very clear. This is a product for external use only. Do not drink it, and do not casually use it for water treatment in public guidance without clear official instructions. A bottle of betadine does not make you look like a professional survivalist. But when everything around you becomes dirtier, slower, and medical help becomes harder to reach, it does one very important thing. It prevents a small wound from having the opportunity to become a much bigger story. 8. Safer allergy medicine for older adults. The wrong allergy pill can make an older adult less itchy, but also leave them drowsy, dizzy, and more likely to fall. This is why allergy medicine in a survival kit should not be chosen by simply buying the strongest option available. For people over 50, the smarter choice is one that controls symptoms while still preserving alertness. In the United States, generic over-the-counter allergy medicines such as loratadine, cetirizine, or fexofenadine usually cost around $5 to $20, depending on the number of tablets and the brand. Allergies during emergencies can come from very ordinary things: dust after storms, mold in damp rooms, smoke from temporary cooking setups, insect bites, unfamiliar plants, old bedding, pets, or unfamiliar food. It may begin with sneezing, runny nose, itchy eyes, rashes, or stubborn, itchy skin. It does not sound like a survival problem, but if an older adult loses sleep all night from itching, scratches their skin raw, wakes up exhausted, drinks less water, and forgets daily medication, one small problem has now created several others. The important thing to remember is that not all allergy medicines are the same. Many people immediately think of Benadryl or diphenhydramine because it is well known. But for older adults, a strongly sedating medicine may not be the best option to use casually. Drowsiness, confusion, loss of balance, dry mouth, urinary retention, or slowed reaction time are all serious concerns when the power is out, the house is dark, and the person is already tired. In survival situations, staying alert is also a form of protection. When using allergy medicine, always follow the label instructions. Do not take extra just to stop itching faster. Do not mix allergy medicine with sleeping pills, cough medicine, cold medicine, or sedatives unless you clearly understand the ingredients. Medicine should be stored in the original box or blister pack, in a dry, cool place away from sunlight and moisture. If the allergic reaction includes difficulty breathing, swelling of the lips, tongue, or throat, dizziness, or a feeling of fainting, this is no longer something to manage with regular allergy medicine alone. But for mild reactions, choosing the right medication can help older adults itch less, sleep better, feel less exhausted, and still keep a clear mind. 7. Antibacterial cream or ointment for external use. A small cut does not scare people the moment it happens. The frightening part usually comes later. A friend of mine in his 60s once told me about opening canned food during a power outage. The lighting was dim, his hands were slightly wet, and everything around him was messy. The lid sliced his finger. He rinsed it quickly, wiped it with a paper towel, and kept working because there were still too many things to handle. At the time, the cut looked completely ordinary, but 2 days later, the skin became redder and more painful. While the house was still hot, clean water had to be rationed, and getting to a pharmacy was no longer simple. That is why having a tube of antibacterial cream or ointment before you actually need it matters. In the United States, common products such as bacitracin, triple antibiotic ointment, polysporin, or store-brand versions usually cost around $4 to $12 for a small tube. This is not an expensive item, but it exists in the most important window of time, after a wound has been cleaned, and before it has the chance to become a bigger problem. The purpose of antibacterial ointment is not to fix every wound. It is meant for small cuts, small scrapes, and minor abrasions after the skin has been cleaned, and you want to reduce the chance of bacteria getting in. For younger people, a scrape may heal quickly. But for older adults, the skin is thinner, circulation may be weaker, And if diabetes is involved, even small wounds on the hands or feet should not be ignored. In conditions with limited bathing, limited clean bandages, sweat, dust, and hands touching dirty surfaces, a small wound can become something the entire household worries about for days. When using it, wash your hands if possible. Clean the injured area, gently dry it, then apply a thin layer according to the instructions on the tube. Do not spread it on like plaster. More does not mean better. Also, do not let the tip of the tube touch the wound directly, dirty hands, or multiple skin areas, because the tube itself can become a source of contamination. Always close it tightly after use. The tube should be stored in a dry, cool place away from sunlight, hot cars, stoves, or high heat. If the ointment changes color, develops an unusual smell, separates, the tube becomes dirty, or it has expired, replace it. A small tube is not worth gambling with when a wound needs to stay clean, and it is important to know the limit. Deep wounds, animal bites, punctures from dirty objects, serious burns, spreading redness and swelling, pus, increasing pain, or wounds in someone with diabetes should not be treated like minor issues. Antibacterial ointment is most valuable when used early in the right place, for small wounds that have already been cleaned. In survival situations, a small injury not cared for properly at the right moment can take away far more time, strength, and peace of mind than you expect. If you cut your hand opening a can or scrape your skin cleaning up after a storm, do you already have something ready to use immediately after washing the wound? 6. Joint pain relief cream or gel. In a crisis, knee pain is not just pain. It can determine whether someone can still walk to get water or has to sit and wait for help. For people over 50, joint pain is not unusual. But in survival situations, it becomes a much bigger issue because the ability to move is a form of independence. As long as someone can still move around, they can get medication, cook food, check doors, climb a few stairs, carry a small water container, or take care of basic daily tasks. When pain forces them to sit still, everything starts depending on someone else. In the United States, joint pain relief products such as diclofenac sodium gel, 1%, commonly known as Voltaren arthritis pain gel, usually cost around $9 to $25, depending on the tube size, brand, and where it is purchased. The main purpose of these products is to help reduce pain in joints such as the knees, hands, wrists, elbows, ankles, or feet, depending on the product. One important detail is that it is applied directly to the skin, so many people feel more comfortable using it instead of taking another pill during the day. But easy to use does not mean it should be used carelessly. Think about the reality. Power outage, hothouse, furniture needing to be moved, water needing to be carried, food needing preparation, daily medications needing to be taken on time. If the knees hurt, an older adult may avoid standing up. If the wrists hurt, even opening a bottle of water becomes difficult. If the back is stiff, bending down to pick something up or standing to cook becomes exhausting. Joint pain does not make everything collapse immediately. It slows people down little by little until they gradually lose their independence. When using joint pain relief cream or gel, apply only to intact skin in the correct amount and frequency listed on the label. Do not apply to open wounds, scraped skin, or irritated areas. Do not tightly wrap the area unless the label specifically allows it. And because these are still anti-inflammatory pain medications, anyone with heart disease, kidney problems, stomach ulcers, high blood pressure, taking blood thinners, or already using ibuprofen, naproxen, or other anti-inflammatory pain relievers should ask a pharmacist before storing this type of product in a medicine cabinet. The tube should be tightly closed and stored in a cool place away from heat and direct sunlight. If the gel changes smell, changes color, separates, dries out, or expires, it should be discarded. In survival situations, joint pain relief gel is not glamorous. But if it helps an older adult walk a few more steps, stand a few more minutes, sleep with less pain, and continue handling basic tasks independently, then it is no longer just an ordinary tube of gel. It becomes a small part of helping them keep control over their own life. 5. Temporary tooth pain relief products. Tooth pain is a very specific kind of pain. It does not need a storm, a power outage, or a major crisis to break someone down. It only needs to happen at the exact moment when seeing a dentist is impossible. One decayed tooth, swollen gums, or a constant dull ache in the jaw is enough to keep an older adult from sleeping, eating properly, drinking enough water, or concentrating. In the United States, over-the-counter tooth pain relief gels or clove oil usually cost around $5 to $15, depending on the type and brand. It is best to buy from a trusted pharmacy. Choose products clearly labeled for oral use, with visible expiration dates and clear instructions. The important thing about these products is that they do not solve the root problem. They only provide temporary relief. But sometimes temporary relief matters a lot because it helps someone eat, sleep, drink water, and endure long enough to reach proper dental care. Clove oil is often mentioned because it contains eugenol, a compound that creates a numbing sensation locally. But this is not a miracle remedy. It should not be swallowed, should not be overused, and should not be applied casually unless the product clearly states it is intended for oral use. With tooth pain gels, the same rule applies. Use according to the label in the correct amount and the correct number of times. If there is an abscess, infection, or severe tooth decay underneath, the product is only masking pain temporarily, not fixing the underlying issue. Store these products in a cool place away from sunlight and heat, and keep them tightly closed after use. If the gel changes color, the oil develops an unusual smell, expires, or the label becomes unreadable, replace it. If tooth pain comes with facial swelling, fever, pus, pain spreading into the neck, difficulty swallowing, or difficulty breathing, that is no longer a situation to simply endure longer. In a crisis, this type of product will not heal everything, but it may help someone stay alert enough, eat enough, sleep enough, and remain strong enough to reach the next step. 4. Digestive enzymes/probiotics. Digestive enzymes and probiotics are not emergency items like ORS, and they do not create the immediate effect that pain relievers do. But their value appears during longer periods of disruption, when the body is no longer eating the way it normally does. In the United States, probiotics usually cost around $10 to $30 for a box or bottle, depending on the number of capsules, bacterial strains, brand, and whether refrigeration is required. It is best to buy from a trusted pharmacy and read the label carefully, because not all products are the same. In survival situations, the digestive system is often one of the first parts of the body to react to change. Older adults may end up eating more canned foods, more dry foods, fewer fresh vegetables, drinking less water, sleeping poorly, and dealing with more stress. All of those factors can lead to bloating, indigestion, irregular bowel movements, reduced appetite, and fatigue. When the gut becomes unstable, overall strength declines as well. Someone who does not feel like eating will usually drink less, sleep worse, and become weaker over time. Probiotics are used to help support balance in the gut microbiome. They are not a treatment for severe diarrhea, food poisoning, intense stomach pain, or intestinal infections. They are more like a foundational support tool, especially when diet changes suddenly or digestion becomes mildly disrupted. They do not rescue someone in minutes, but they may help the body remain more stable over longer periods. When using probiotics, always follow the instructions on the product label. Do not assume more is better. Some products require refrigeration, while others can be stored at room temperature. 3. Sterile saline. There are some items in a medicine cabinet that do not feel dramatic. They do not reduce fever. They do not relieve pain. They are not strong antiseptics. But when they are missing, you realize something very simple. Before applying medicine, before putting on a bandage, many situations need to be cleaned first. Sterile saline is one of those items. In the United States, eye wash bottles, wound wash sprays, or single-use saline vials usually cost around $3 to $10. Do not mix salt and water at home and assume it is the same thing. The real value of sterile saline is not the word saline. It is the word sterile. One of the most common mistakes people make is applying medicine immediately to a scrape or rubbing the eye aggressively when dust gets inside. But during a crisis, hands may be dirtier, clean water may be limited, lighting may be poor, and the environment may contain more dust and debris. A small scrape contaminated with dirt or sand may still have particles trapped inside if it is only wiped quickly and bandaged. Sterile saline does not do anything glamorous. It simply helps rinse away dust, dirt, sweat, small debris, and surface contamination. For older adults, this step matters even more because the eyes are often drier, the skin thinner, and wounds slower to heal. Store it in a dry, cool, clean place away from sunlight and high heat. If the bottle leaks, becomes cloudy, loses its seal, develops particles, or expires, replace it. For something used on eyes and wounds, cleanliness is the real value. If dust, smoke, or dirt gets into your eyes or a scrape, what do you usually use first to rinse it out? 2. Zinc oxide cream/Vaseline. A cracked heel does not sound like a survival problem until it makes an older adult unwilling to take another step. When people think about emergency preparedness, they immediately think about water, canned food, flashlights, and backup batteries. But they forget that the body still has to touch the world every day. Feet still have to walk. Hands still have to grip things. Skin still has to deal with sweat, friction, cold, heat, moisture, dust, clothing worn too long, and sometimes several days without normal hygiene. In the United States, zinc oxide cream usually costs around $5 to $12. This is not an expensive item, but it does something very important. It helps keep the skin from breaking down too easily. Zinc oxide works like a moisture and friction barrier. Useful when the skin is irritated, chafed, exposed to sweat for long periods, or constantly rubbing against surfaces. Vaseline works more like a moisture seal, helping reduce dryness and cracking, protecting the surface of the skin during cold, dry weather or when the skin begins to peel. One protects against moisture, one protects against dryness. It sounds simple, but for people over 50, simple is often the most reliable thing. When using them, apply only a thin layer to clean, dry skin. There is no need to apply a thick coating. With Vaseline in a jar, do not dip dirty fingers directly inside. Keep the rim clean, close it tightly, and avoid high heat. But do not use either of these products to seal over dirty wounds, areas with pus, swelling, redness, or skin that is rapidly worsening. They are most valuable when used early on clean skin for mild problems. In survival situations, protecting the skin is not about beauty. It is about preserving the ability to walk, rest, and care for yourself. 1. Anti-diarrhea medicine. The main purpose of anti-diarrhea medicine is to reduce the number of bowel movements in cases of mild diarrhea without dangerous warning signs. It sounds simple, but in survival situations, this matters a great deal. Diarrhea does not just make people uncomfortable. It pulls water, electrolytes, and strength out of the body. For older adults, several episodes of diarrhea in a short period can leave them dizzy, weak in the legs, unsteady when standing, eating less, and more likely to fall. What many people do not realize is that the digestive system can become unstable before food even runs out. 1 bottle of unsafe water. Food in the refrigerator that warmed up after a power outage. Several days of canned food, dry food, too little vegetables, too little water, or simply prolonged stress. At first, it is just mild stomach discomfort. Then repeated trips to the bathroom begin. The person starts avoiding food, avoiding water, lying down more often, looking more exhausted. During a crisis, this can drain the body surprisingly fast. With over-the-counter loperamide, the adult dosage commonly listed on the label is 2 tablets of 2 milligrams after the first loose stool, followed by 1 tablet of 2 milligrams after each additional loose stool, without exceeding the daily limit within 24 hours. Many products limit the maximum to 8 milligrams per day, but the product label must always be read carefully. Do not take extra just because you want to stop the diarrhea faster. Anti-diarrhea medicine is not glamorous, but when the digestive system loses control, it may help an older adult hold on to fluids, strength, and stability. In survival situations, sometimes simply stopping the body from losing control of the stomach is enough to buy more time to stay standing. In a crisis, what do you think is more dangerous? Going without food for a few hours, or the body losing water from constant diarrhea? In the end, survival does not always begin with big items. Sometimes it begins with a small oars packet, a bottle of antiseptic, a tube of skin cream, or the right daily prescription pill taken on time. For older adults, preparedness is not about living in fear. Preparedness is about preventing the body from being pulled down too quickly when life starts drifting away from normal. A fever, a case of diarrhea, a small cut, joint pain, or a few days without medication. All of these can become major problems if nothing is ready at home. Check your medicine cabinet again today. If you could add only 1 item first, which one would you choose? Leave a comment below.